Hi, everyone. Thank you for joining us today for our presentation, Liberating Black Birthing People, How Policy Can Improve Maternal Health. I am Kiley Mayfield, Birth Equity Policy Analyst for the National Birth Equity Collaborative, and my work primarily revolves around policy and advocacy on the local and state levels in Louisiana and New Orleans.
And I'm Alise Powell, Policy Analyst at NBEC, and my work primarily revolves around federal policy strategy. The National Birth Equity Collaborative is a New Orleans-based nonprofit organization grounded in reproductive justice and health equity. NBEC creates global solutions that optimize Black maternal, infant, sexual, and reproductive well-being. We shift systems and culture through training, research, technical assistance, policy, advocacy, and community-centered collaboration. Our work is done on the local, state, national, and global level as we recognize adverse or undesirable pregnancy, birth, and health outcomes for Black mamas, babies, and their village. Next slide. So I'll start by defining reproductive justice in the words of Loretta Ross, pioneer and co-founder of the sister song Reproductive Justice Collective. Reproductive justice is the human right to maintain personal bodily autonomy, have children, not have children, and parent the children we have in safe and sustainable communities. Factors such as education, income, geographic location, immigration status, and potential language barriers and equitable access to healthcare are common barriers to achieving reproductive justice. The RJ framework encompasses both reproductive health and reproductive rights, while also using an intersectional analysis to emphasize and address the social, political, and economic inequities that affect women's reproductive health and their ability to control their reproductive lives. It examines how the ability of any woman to determine their own reproductive destiny is directly linked to the conditions of their communities and how they are impacted by reproductive and systematic oppression. In order to achieve reproductive justice, we must first analyze the power systems at work against justice, address intersecting oppressions, and continue to make sure we center the most marginalized among us. And lastly, join together across issues and identities, which is exactly what's being done today. Next slide.
Our president and founder, Dr. Joy Creel Perry, defines birth equity as the assurance of the conditions of optimal births for all people with a willingness to address racial and social inequities in a sustained effort. And this definition encompasses what it means to advocate for or fight for all birthing people and families so that they are able to have the opportunity to experience a birth, a healthy birth, without any barriers. So we're going to move into discussing the root causes and social determinants of health that have led to our current maternal health landscape in the nation. Social determinants of health are those conditions that people are born in, grow in, live in, work in, and age in. These circumstances are shaped by the distribution of money, power, and resources at the global, national, and local levels. Some examples include transportation, housing, healthcare, education, and employment. Racism has been identified as a social determinant of health because it affects health both directly and indirectly. So chronic stress is a way that we are impacted directly by racism. Race-based discrimination across multiple systems, which creates differential access to things such as schools, safe neighborhoods, good jobs, and quality healthcare are examples of ways that we are affected by racism indirectly. So Dr. Jones has identified 3 levels of racism, and the first level is institutionalized racism, which is the structures, policies, practices, and norms resulting in differential access to the goods, services, and opportunities of societies by race. And this level is extremely important for our work and for this presentation, because the majority of the work that we're doing in policy really addresses institutional racism. The next level that I want to talk about is personally mediated racism or interpersonal racism. So that's the biases and differential assumptions about the abilities, motives, and intentions of others by race. And this policy, this level of racism really comes to play when, our beliefs about race impacts our interactions with other people. And the final level of racism that I want to talk about is internalized racism. And that's the acceptance and entitlement of negative messages by stigmatized and non-stigmatized groups.
So in order to fully understand reproductive justice, we have to also talk about the reproductive injustice that has gone on in this country for hundreds of years. Black women's bodies have been used as vessels for the institution of slavery in the United States. The regulation of Black women's reproductive decisions has been a central aspect of racial oppression in America. Enslaved pregnant Black women were forced to work in the fields on plantations up until their labor, and were rarely given a chance to rest and bond with their babies, and were required to go back into the fields with their babies strapped on their backs. Furthermore, the institution of slavery in the United States opened the door for all types of unjust medical experimentation on Blacks. Dr. J. Marion Sims, historically known as the father of modern gynecology, routinely performed several experimental vaginal surgeries on Black women without anesthesia. He believed that Black women could endure higher levels of pain than white women, and that surgeries were justified. Black women have also been forced to care for and breastfeed white babies, and that has led to the long and painful history of eugenics and systemic manipulation in the Black community. Even the notion of family planning in regards to Black women and birthing people has been, suffice to say that we don't have the tools or bodily autonomy to choose if or when to start a family. We would also be remiss to not mention the ongoing pandemic that has disproportionately affected Black people and ongoing police brutality, which Kiley will touch on later in the presentation. Next slide. So some background on the maternal health crisis. When comparing maternal health in the 10 richest countries in the world, the United States comes in dead last. The United States is experiencing a maternal mortality crisis that disproportionately affects Black women more than any other racial group. Black women are more than twice as likely as white women to die from complications during pregnancy or childbirth, and education and income status are not protective factors. Racism is woven throughout our society, and disparities in health outcomes are manifestations of racism, which is the root cause of maternal health disparities. Due to weathering and racism's presence in healthcare, Black women are more likely than white women to experience preventable maternal deaths and severe maternal morbidity. Structural forces perpetuated by racist policies created inequitable systems of housing, food stability, education, access to care, and safety. Racism, not race, is responsible for the maternal health disparities. Next slide.
As we look at the background, it's important that we recognize some of the more recent events that have impacted Black maternal health, such as COVID-19. So Black Americans were disproportionately impacted by COVID-19, and it had an overwhelming impact on Black maternal health outcomes. And some of the clinical barriers that we saw as it related to COVID-19 and maternal health was around access to doulas, support and birth workers, as well as visitors limitation and restrictions for reentry. Police violence is another recent yet continuous experience that Black people have had to endure in this country. And it disproportionately impacts the Black community. So the traumas of police violence create stress and adds to the allostatic load and weathering, which contributes to maternal mortality. And I just want to take this time to just define what weathering is. So weathering is the phenomenon of chronic or ongoing stress that causes higher levels of disease or biological aging in Black people, which impacts, birth outcomes. There was a 2016 study that found police killings of unarmed Black people substantially decrease the birth weight and gestational age of Black infants that resided in close proximities to those killings. So now that we have covered the background and social determinants of health that have impacted our Black maternal health landscape in this nation, we're going to shift to the ways that we are working to help liberate Black birthing people through policies. As discussed previously, institutional, systemic, structural racism has led to the current Black maternal health crisis in this country. But I love this slide because it draws the line between how power imbalances creates those health disparities that we see in maternal health. It shows that power imbalances creates racist policies, and then those racist policies in turn creates those health disparities that we see. But it's very important that we remember and keep at the forefront of our mind that those past political actions can be undone with deliberate political actions.
So diving a little bit deeper into the importance of policy change in Black birth outcomes starts with taking the focus off of the individual and placing it on the structures and systems that have upheld the health disparities. Here at NBLAC, we believe community-based organizations should inform policy, and it's our job to take those recommendations and transform them into executable policy solutions. The ongoing Black maternal health crisis can be addressed with the right tools and support from policymakers. Next slide. So at NBAC, our policy priorities incorporate the use of the reproductive justice framework, which incorporates both reproductive health and reproductive rights. So we're looking at addressing racism within the healthcare system, promoting health equity and increasing access to quality, comprehensive, and affordable care, improving data collection, disaggregation, and dissemination, and supporting policies that address systemic racism and social risk factors. Next slide. NBEC strongly supports the Black Maternal Health Omnibus Act, and we know that there are many factors leading to the disparate maternal health outcomes that Black women experience, and we concede that only a multifactorial cross-sector solution can effectively and meaningfully address this national crisis. The Omnibus is a comprehensive package of legislation comprised of 12 bills that not only addresses a multitude of factors that are responsible for the unnecessary deaths of Black pregnant people and the near misses, and includes issues of systemic racism and social risk factors like housing, transportation, and environmental risks. It also enlivens the core tenets and principles of reproductive justice, which is foundational to our work and a key driver in our advocacy efforts. Next slide. So now I'll briefly go over the 12 bills of the 2021 Momnibus. So first we have the Social Determinants for Moms Act. This bill addresses the consequences of inequities and factors contributing to adverse maternal health outcomes for Black women. We also have the Kira Johnson Act. This builds capacity and support for those dedicated to addressing the Black maternal health crisis and holds health systems accountable to addressing racial justice. We also have the Perinatal Workforce Act. This bill deconstructs barriers to education and employment opportunity for maternity care providers of color to increase the cultural congruence of the maternal care workforce. Next slide. We also have the Protecting Moms Who Served Act. This bill centers the experience of women veterans to understand and address disparities in maternal health outcomes. We also have the Justice for Incarcerated Moms Act. This bill bridges the criminal justice system with reproductive health justice to end horrific and discriminatory practices enforced upon incarcerated women. And we also have the Maternal Health Pandemic Response. This bill supports the heightened barriers of access and security that women face during the COVID-19 pandemic. Next slide. We have the Data to Save Moms Act, which stands with Indigenous sisters to address the challenges that specific tribal communities face in terms of data collection. We have the Moms Matter Act. This bill promotes a greater linkage between mental health and maternal health to improve outcomes, especially for women of color. The Tech to Save Moms Act provides integrative technological resources that are fitted to maternal health needs and enables collaborative learning and inclusive capacity building. Next slide. The last three, we're starting with the Impact to Save Moms Act. This bill emphasizes the right to healthcare and long-term health coverage by leveraging payment models and extending health insurance coverage. Protecting Moms and Babies Against Climate Change is one of the newer bills in the 2021 Momnibus. This addresses geographic and environmental inequities that impact maternal and child health disparities and outcomes. And lastly, we have the Maternal Vaccinations Act. This bill seeks to improve maternal vaccination rates by uplifting appropriate programs and awareness dedicated to addressing vaccine hesitancy. Next slide.
The Mama Plus Health Policy Agenda is a policy initiative that was originally started by representatives from the National Birth Equity Collaborative, Birthmark Doula Collective, as well as the Institute of Women in Ethnic Studies to address the maternal health crisis that exists in Louisiana and in New Orleans. And one thing that we recognized was there are other people and organizations dedicated to addressing the maternal health crisis. So we created a work group for our Mama Plus Health Policy Agenda to just connect and collaborate with others doing the work. Our work group is comprised of individuals from various disciplines and backgrounds. So we have doctors, midwives, doulas, public health professionals, representatives from the Louisiana Department of Health and the New Orleans Mayor's Office. We have people with lived experiences, people from criminal justice organizations, reproductive justice organizations, social justice organizations, and organizations that focus on maternal and child health, such as the New Orleans Maternal Child Health Coalition. We also have researchers and individuals who work in academia or at universities or colleges. So our Mama Plus Health Policy Agenda is loosely fashioned after the federal omnibus, which Alise previously touched on. And I just want to highlight a couple of differences between our Mama Plus Health policy agenda and the federal omnibus. So while the federal omnibus has a national focus, our focus is on both the state and local levels for Louisiana and New Orleans. Another difference is our Mama Plus Health policy agenda includes multiple bills, and those bills were worked on directly by members of our work group, and other bills we may not have worked directly on, but we support and recognize their importance in addressing the maternal health crisis. So I want to just go over the 8 titles that we have for our Mama Plus Health policy agenda. And as I read through them, you might notice that some of the bills are specific to local or state level policies, while others have both the local and state component. And we really wanted our titles and the bills incorporated in this policy agenda to address maternal health, not just as it relates to healthcare, but also those social determinants of health. So our titles focus on addressing social determinants of health, diversifying and increasing the perinatal workforce, promoting extended Medicaid to 1 year postpartum for maternal health, improving maternal health care and support for incarcerated birthing people, investing in maternal mental health care and substance use disorder, improving telehealth and other digital tools to improve maternal health care to underserved areas, increasing payment for group prenatal care, and establishing a position on the local and MCH, a maternal child health position on the local level. This next slide highlights some of the bills that work group members work directly with legislators on in this current legislative session. So I will note that our legislative session began on April 12th and it will end on June 10th. And all of the bills that I will mention now are still moving through the legislature. So the first bill that I want to highlight is Senate Bill 215, or the Pregnant Workers Fairness Act. This bill was sponsored by Senator Barrow, and it focuses on providing accommodations for pregnant workers. It enables pregnant birthing people and new moms to stay at work, maintain financial stability, and be healthy. It can also reduce adverse birth outcomes. So some of those accommodations include additional bathroom breaks, or a stool for workers who may have to stand for long periods of time. The next bill that I want to highlight is House Bill 146, or a tax credit for those who experience the stillbirth. And this bill is sponsored by Representative Hilferty. So this bill would provide a $2,000 tax credit to those families who experience a stillbirth, and it addresses financial, emotional, and mental effects and hardships related to that experience. It would allow for access to mental health care and support, and it also provides for financial support for burial or medical expenses, or any other expenses that the family has occurred as a result of the pregnancy and the stillbirth. House Bill 190 is focused on midwifery and doula care. And this bill is sponsored by Representative Willard, and it relates to reimbursements for doula and midwifery services. And it would aid in increasing and diversifying the perinatal workforce, and it promotes non-discrimination in reimbursements and payments for midwives and doulas. House Bill 468 is the Medicaid extension for the postpartum period, and it's sponsored by Representative Landry. So this bill would extend Medicaid to 1 year postpartum. A large portion of maternal mortality events occur in that year after individuals give birth. And This bill would allow for the continuity of care for those individuals, and it would also provide the most vulnerable population with stable health coverage. And it can help identify and address maternal warning signs and symptoms before they lead to adverse or fatal events. And some examples of those warning signs and symptoms include swelling, dizziness, overwhelming tiredness, and fainting. And the final bill that I will touch on is House Bill 495, which is around removing the collaborative practice agreement. And this bill is sponsored by Representative Ivy. So the collaborative practice agreement is a formal document that addresses parameters of collaborative practice that's mutually agreed upon by either a nurse practitioner or a certified nurse midwife and physicians. So the removal of the CPA or collaborative practice agreement would allow nurse practitioners and certified nurse midwives to practice without a physician's supervision. So they would have full practice authority. And it will also remove access barriers and financial burdens. So it would increase access and it would address the maternity care deserts across this state. And in Louisiana, we have 24 parishes that do not have obstetrical providers. So that would definitely help address, the maternal health crisis as it relates to rural areas as well. And we also worked with legislators on resolutions. So the first resolution that I would like to talk about is HCR 85, and this resolution pertains to maternal health for the incarcerated population. It's sponsored by Representative Landry, and it's a study resolution that would look at the implementation of past legislation that impacts the pregnant incarcerated population, and it also examines the accommodations and health care that those pregnant people receive while incarcerated on the parish or jail level and also in prisons. We have also been working on maternal mental health resolutions with Representative Duplessis. They will be filed later on in the very near future. So we have two resolutions that we have been working with him on. The first one relates to creating a maternal mental health task force. And the second resolution would relate to screenings for maternal mental health. And before I move on, I do want to highlight that we have been in conversations with the mayor's office locally around policies to address the maternal health crisis as in New Orleans. And we've also been in communication with offices of city council members. And our focus has primarily been on this legislative session since it's currently ongoing, but we plan to shift more of our focus back to the local level once legislative session ends on June 10th. So how can you get involved? It is extremely important that, everyone is involved in these efforts. And if you are interested in the information that I've shared about the Mama Plus Health Policy Agenda, please sign up for action alerts for the Louisiana legislation at the following link for the New Orleans MCH Coalition. And if you sign up at this link, you will receive action alerts through the Action Network and updates on legislation that we are following. Another way to get involved is to reach out to your legislators to inform them on why maternal and child health issues are important. Legislators love to hear from their constituents or the people that voted them in. So you can find your Louisiana legislators at the following link, which is legis.la.gov/legis/find my legislators. Or you can find your federal elected officials at usa.gov/elected officials. You can also share information with people in your family, in your home, in your network, in your community. It is extremely important that we share the information that we're learning, share information about policies and the maternal health crisis with those we come into contact with. And the final way that you can get involved is to spread awareness on social media. So you can put things in your stories, you can post them on your page, you can reshare, repost posts that you see, and you can DM information or private message information to, your close contacts to uplift what's going on, to uplift policies, to uplift the problem, and uplift the solutions that we are doing, we're working towards.
All right, and also you should follow us at Birth Equity on Instagram and Twitter and Facebook, and our website is birthequity.org. And please feel free to connect with us and send an email if you have questions to info@birthequity.org using the subject line policy liberating Black birthing people. Thank you so much for tuning in, and we look forward to joining you all in spreading justice and joy.
Thank you for joining us. Have a good day, everyone.